I'm Marcella Palmer for Summit Medical Group. It's Men's Health Month, so during the month of June, Summit Medical Group will have articles and videos on its website that highlight ways men can protect, maintain, and improve different aspects of their health. Stay tuned.
Welcome to Medical Monday with Summit Medical Group. I'm Dr. Matt Garberina, Summit Medical Group board-certified orthopedic surgeon. Shoulder pain can have many causes, but if you're an athlete or over 40 and active, you may be more susceptible to an injury of your rotator cuff, the muscles and tendons that connect your upper arm bone with your shoulder blade. Well, the rotator cuff is a group of 4 muscles that originate on the shoulder blade and attach onto the top of the arm bone called the humerus. And they attach via a tendon, which is a tough, fibrous layer of tissue. And a rotator cuff tear is either a partial or complete detachment of one or more of those tendons. A rotator cuff tear can be a result of the normal aging process, or it can be a result of injury. People who are at risk are heavy laborers, those who do a lot of weightlifting, people who have a history of being an overhead athlete like a pitcher or a swimmer or a volleyball player, and also those patients who are older than 50 years old. The most common symptom of a rotator cuff tear is pain in the shoulder. The pain is usually on the outside of the shoulder and sometimes can progress down just above the elbow. As we naturally age, our tendons get weaker, just like we get wrinkles on our face and gray hair on top of our head. The tendons can get weaker, and even more innocuous injuries can lead to a tear. And this can lead to symptoms such as pain, trouble with overhead activity, trouble sleeping at night, and just trouble doing the things that we most enjoy in life. Rotator cuff treatment depends on whether the patient has a complete tear or a partial tear, their age, their activity level, and whether they've had any treatment to date. For smaller tears or for inflammation that's called bursitis, we can often treat them conservatively with cortisone injections, physical therapy, anti-inflammatories, and activity modification. Patients who have full thickness tears often respond very nicely to surgical management, which consists of an arthroscopic or an open rotator cuff repair. A small percentage of patients with rotator cuff tears will have what we call irreparable tears. They tend to be older patients with larger, more chronic tears, where repairing the tendon back to the bone will not really help them. These patients usually have significant trouble even raising their arm overhead. Patients who are over 60 and have rotator cuff tears, we treat them on a case-by-case basis. If they're very active, if they're having trouble sleeping, if they're having trouble doing their activities of daily living, if they've failed non-operative treatment, we'll often suggest that they too undergo an arthroscopic or an open rotator cuff repair. For patients who are older, who are having very minimal disability from the rotator cuff tear, who respond well to conservative management, we'll often follow them expectantly and see if they improve. This has been your Medical Monday with Summit Medical Group. Thanks for watching. Summit Medical Group is here to help you live well and stay well.